Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Blood and blood disorders. Introduction. Your blood is living tissue made up of liquids and solids. Blood disorders affect one or more parts of the blood and can cause health problems. There are many disorders that can affect the blood. Blood disorders may cause blood clots, excessive bleeding, fatigue, weakness, and in some cases, death. This program explains blood and blood disorders. It covers common symptoms of blood disorders as well as treatment information for specific conditions. Blood. Blood carries nutrients, oxygen, and hormones to different parts of the body. It also sends toxins and waste materials to the liver and kidneys to be removed from the body. Hormones are chemicals made by glands. They control the actions of certain cells or organs. Blood is made of blood cells floating in plasma. Plasma is mostly made of water with chemicals in it. There are three basic types of blood cells: red blood cells, white blood cells, platelets. Red blood cells, or RBCs, are also called erythrocytes. They make up almost half of the blood and are filled with hemoglobin. Hemoglobin is a protein that picks up oxygen in the lungs and delivers it to cells all around the body. White blood cells, or WBCs, are also called leukocytes. They fight disease and infection by attacking and killing germs that get into the body. Platelets are also called thrombocytes. They are small pieces of cells that help blood clot and that stop bleeding. Blood cells are formed in the soft, spongy center of bones, called the bone marrow. General symptoms. Many blood disorders have similar symptoms. The main symptom is feeling very weak and tired. Other common symptoms of blood disorders are a fast heart rate or shortness of breath, excessive bruising or blood clots, fever, headache, speech changes, confusion or seizures, paleness or yellow-colored skin. Some blood disorders may also cause bone or chest pain, coldness in the hands or feet, ringing or humming in the ears, weight loss. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Anemia. Anemia happens when a person doesn't have enough red blood cells. When you don't have enough red blood cells, your blood can't carry enough oxygen to your body. With some types of anemia, you may have low numbers of all three types of blood cells. Anemia can also happen if your red blood cells don't contain enough hemoglobin or if the hemoglobin is defective. Most cases of anemia are mild and easily treated, but severe or long-lasting anemia can damage the heart, brain, and other organs of the body. It may even cause death. Anemia can be caused by one or more of the following: blood loss, high rates of blood cell destruction, lack of blood cell production, pregnancy. Anemia can cause complications if left untreated. Complications of anemia include damage to organs such as the kidneys, heart failure, problems with the rate or rhythm of the heartbeat. Treatment of anemia depends on the type, cause, and the severity of the anemia. Treatments may include dietary changes or supplements, medicines, or procedures. Low levels of vitamins or iron in the body can cause some types of anemia. Your healthcare provider may recommend that you include more iron-rich foods in your diet or that you take supplements. Your healthcare provider may prescribe medicines to increase the number of red blood cells your body makes. Medicines can also treat some underlying causes of anemia. Medical procedures may be needed to treat severe anemia. These procedures can include blood transfusions, blood and marrow stem cell transplants, or surgery. A blood transfusion is a safe, common procedure in which blood is given to you through an intravenous line in one of your blood vessels. A blood and bone marrow stem cell transplant replaces your damaged stem cells with healthy ones from another person. Stem cells are found in the bone marrow. They develop into red and white blood cells and platelets. If you have serious or life-threatening bleeding that's causing anemia, you may need surgery to control the bleeding. Platelet disorders. Platelet disorders can result from having too few or too many platelets, or from platelets that do not work properly. If your blood has a low number of platelets, you may be at risk for mild to serious bleeding. Sometimes these types of platelet disorders are also called bleeding disorders. There are different types of bleeding disorders. In some cases, the body's immune system may attack platelets and destroy them. This causes a low number of platelets and leads to excessive bruising and bleeding. In other cases, blood clots may form throughout the body and cause a low platelet count. Some types of bleeding disorders may also result in damaged red blood cells clogging the kidneys, leading to kidney failure. If your blood has too many platelets, you may have a higher risk of blood clots. Blood clots may cause the loss of a limb, strokes, and even death. Thrombocythemia and thrombocytosis are conditions in which your blood has a higher than normal number of platelets. Thrombocytosis may be caused by certain types of cancer, including lung cancer and breast cancer, removal of the spleen, inflammatory or infectious diseases, reactions to medicine. With other platelet disorders, the platelets do not work as they should. For example, in von Willebrand disease, the platelets cannot stick together or cannot attach to blood vessel walls. This can cause excessive bleeding. Treatment of platelet disorders depends on the cause. Treatment for a low blood platelet count in bleeding disorders may include medicines, procedures, surgery. Medicines may be given to decrease the activity of the immune system. Medicines may also be used to increase or lower platelet counts. Procedures used to treat platelet disorders may include transfusions of plasma, platelets, or red blood cells, platelet pheresis, which removes extra platelets from the blood. In some cases, surgery may be done to remove the spleen. The spleen may contribute to the destruction of platelets. Eosinophilic disorders. Eosinophils are a type of white blood cell. They help fight off infections, and they play a role in your body's immune response. Normally, your blood doesn't have a large number of eosinophils. Your body may produce more of them in response to some disorders and health problems, such as allergic disorders. When your body produces more eosinophils, they build up and cause inflammation. In some conditions, the eosinophils can move outside the bloodstream and build up in organs and tissues. These conditions are called eosinophilic disorders. Idiopathic hypereosinophilic syndrome is an uncommon disorder. It happens when a high number of eosinophils are in the blood for more than 6 months with no known cause. The increased number of eosinophils can damage the brain and nerves, heart, lungs, liver, skin. Idiopathic hypereosinophilic syndrome can affect anyone, but it is more common in men older than 50 years of age. Without treatment, more than 80% of the people who have this syndrome die within 2 years. Heart damage is often the cause of death. With treatment, most people survive. Treatment for idiopathic hypereosinophilic syndrome often includes medicines. Different types of medicines may be used. Cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them by replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancerous, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Leukemia is cancer of the white blood cells. In leukemia, the bone marrow produces abnormal white blood cells. These cells crowd out the healthy blood cells, making it hard for blood to do its work. Multiple myeloma is a cancer that begins in plasma cells, a type of white blood cell. In time, these plasma cells collect in the bone marrow and in the solid parts of bones. Treatment for cancers of the blood may involve chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell transplant. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Your blood is living tissue made up of liquid and solids. Blood disorders affect one or more parts of the blood. They may cause blood clots, excessive bleeding, fatigue, weakness, and in some cases, death. There are many disorders that can affect the blood, including anemia, platelet disorders, eosinophilic disorders, cancers of the blood, including leukemia and myeloma. Treatment for blood disorders depends on the cause. Treatment may include medicines, medical procedures, or surgery. If cancer is the cause, treatment may include chemotherapy, radiation therapy, targeted therapy, immunotherapy, or stem cell transplant. Talk to your healthcare provider if you notice any of the symptoms of blood disorders or other changes. Finding a problem early makes treatment easier in most cases. Thank you for using Explain.